enter the room.
Okay, hello, examiner. My GMC number is 8070516. May I proceed? Hello.
Yes, please proceed.
Okay. Hello, I am Dr. Tarek, one of the doctor in this department today. I believe I'm talking to Adam Tucker's daughter.
Yes, doctor. My name is Jolene Tucker.
All right. Well, Johnny, before proceeding further, can you quickly confirm your father's name and age for me, please?
Yes, doctor. My father's name is
Mm-hmm.
Adam Tucker, and he
Okay.
is 70 years old.
All right. Okay. Is Julia fine with you?
Yeah, sure,
Okay.
doctor.
All right. Well, Julia, I am here to talk about your father. So I am here for that. But before proceeding further, I just want to have a little bit conversation about your father's general condition. Is that fine with you?
Yeah, sure, doctor. I
Mm-hmm.
myself am here to understand my father's current condition
Mm-hmm.
and what the
Uh-huh.
next steps would be.
Yes. Julia, I am here for that. So Julia, can you tell me, I understand it, that it might not be, easy for you to go through all of this thing again and again, but I just wanted to know that what happened exactly, 7 days back when your father is admitted with us. Do you have any idea about that?
Yeah, doctor. My
Mm-hmm.
father Adam, he
Mm-hmm.
collapsed at home while eating
Mm-hmm.
breakfast a week ago. He
Mm-hmm.
was not moving and not responding to us, so we
Mm-hmm.
called an ambulance immediately. And he
Mm-hmm.
was diagnosed with a condition called stroke. So
Okay.
he
Okay.
has been receiving treatment, but there has not been much improvement. And
Mm-hmm.
today I was told that there is an important update about his condition.
Mm-hmm.
So I'm really, worried about it. So can you kindly tell me about his condition now?
Yes, Julia, I'm so sorry, and Uh, I'm so sorry about the whole situation, and I understand that, it must be very difficult for you as well, seeing your father going through all of these things. And uh, do you have any idea what stroke is? And do you have any idea about what it is?
No, doctor,
Mm-hmm.
no one has given any update about his condition or explained what stroke really is.
All right, okay. Well, Julia, actually, like just like any other organ in our body, our brain also need a blood supply, okay? And whenever this blood supply towards the brain gets stuck or, reduced, this leads to a condition that's actually called stroke, and that's usually the symptoms that your father had. I'm so sorry about that, okay?
Okay.
All right. So, Julia, are you next of the kin?
Yes, doctor, I am.
And do you have the lasting power of attorney?
Not sure that my father has any lasting power of attorney.
Okay, all right, okay. So, Julia, are you here all by yourself, or do you want me to call some of your friends or family or anything like that?
No, doctor, I'm here myself, and
Mhm.
just please tell me that what really is happening. This all conversation is making me worried.
Okay, I'm so sorry about that. Yes, Julia, I am here for that, and if you need any help regarding anything, I just want you to know that we are here for you. Okay? So, Julia,
Thank
you
you, doctor.
mentioned, okay, so Julia, you mentioned to me that your father has been admitted with us 7 days back because he was having this stroke. And as I have already explained to you that what stroke is, was I understandable?
Yes, doctor, you were.
Okay, okay. So, your father was treated with us from the last 7 days. And today we also did a CT scan on him. And in terms of CT scan, I do not have a good news for you.
Okay.
Mhm.
Okay. Uh-huh.
Actually, according to the CT scan, it is highly unlikely that your father is going to make out make make out from it. I'm so sorry
What do
about
you
that.
mean, doctor? I really can't understand. Like, you are saying, what you are saying is that there cannot be no any improvement in my father's condition.
It's not about the improvement. It's about, it is highly unlikely that he is going to make out from this condition. I'm so sorry about that.
What that? I don't know what to say, doctor.
I,
Sorry. Yeah, sorry.
I'm so sorry about the bearer of this news. I wish I could have something else to tell you. And just take your time and whenever you feel like you are able to talk again, just I'll be continue with them. Okay?
So, doctor, like, are you giving up on him, or what will you do for him now?
Actually, Julia, I'm so sorry. Actually, we never ever give up on any patient. We never ever do this thing with our patient. As your father had a CT scan, and CT scan reports show that that a lot of the part of the brain has been damaged, right? So he is already in so much miserable condition, and if we are going to do any other intrusive measures on him, that's going to cause more misery to his condition, right? So that's why some multidisciplinary team have been decided to,
2 minutes remaining.
to start him on supportive and comfortive management, in which we are going to make sure that he's not in pain. We are going to make him as comfortable as we can, and we are going to look after him. We are going to work on his hygiene as well. We're not giving up on him, but we are just managing him, and we are just making him as comfortable as we can. Okay.
So, doctor, like, you won't be giving any, medications to treat his stroke. Like, is there no way around this stroke condition?
Yeah, actually, there is it's all about the specialist call. If he had got some serious infection or something like that, then we might have to give him some antibiotics as well. But that's totally on the specialist. But right now, as per the multidisciplinary team, we are not going to give him any treatment apart from this comfortive and and this hygienic measures. Other than that, we're not going to give him any other intrusive measures or anything like that. Okay.
So, doctor, stopping this medication will not kill him, right?
Actually, killing is a natural thing, and we are not, stopping any medication or, giving him any medication. That's not going to do any good for your father. I'm so sorry for, for telling you this thing, but uh, we just try to make him as comfortable as we can. I'm so sorry about that.
Okay, doctor. Okay, I understand.
Yeah, Julia. And do you have any siblings, any family, any mother?
Move on to the next station.
That was a good one. You made some mistakes, but overall it was a good one.
I'm sorry, Dr. Umar, your voice was a little bit cutting. You made me what? I'm sorry.
I'm just saying, like, generally, overall, it was a good scenario by you, but
Okay, thank
there
you.
was some mistakes. Like in the
Okay,
last, you
okay.
said killing was a natural thing.
Okay, I was like, I'm
Really,
sorry.
killing.
I was like, actually, I just want you to like understand that that's going to be happen naturally. But when the words came out of my mind, even I was like, what I was saying. So
Okay.
yeah.
Other than that, it was good. So when you asked about me, the history of my father,
Mhm.
like what I know about his condition, you should have also asked about, Maftosa, like his past medical
Oh
history,
yes, yes,
medication,
yes, yes, yes.
family, support
Okay.
system, like who else lives with him, what's his condition socially. Such things are also important. And
Oh, God.
other, other than that, it was okay. And yeah, so, but the last line was kind of, shocking. Killing was a natural thing, but other than that, it was okay.
Okay. So, how can I answer this question? Like, if somebody asks me, okay, stopping medications will going to kill him. So, how I'm going to answer this question?
Yeah, we're going to address that because
Okay.
there are also a couple of things that you mentioned that you'll be giving antibiotics. So you need to understand what palliative care is. So we'll be taking, we will be going through that shortly. Thank you, Dr. Umar, for that great simulation. And if you can stick around, we will be explaining this case, and then we will be doing another mock to see, how well you improved. right?
All right.
So I'm
Okay.
explaining
So
how the scenario went. We'll just quickly do another mock to understand whether or not, there was any improvement after understanding some salient points from here. Yeah. So before we start, I just wanted to ask you a couple of things. So doctor, what do you think was the main issue here? Like, what did you identify as the issue, in this case?
Um, Actually, we are not going to give him any treatment apart from this palliative care measures, right? And we have to explain this thing to the patient's daughter.
Absolutely. So is it palliative care a treatment again? Like, how are you going to understand that? I mean, explain that. You are.
That's a comfortive and comfortive treatment, right? Yes.
Yes. So mainly we're not doing any curative treatment, right? So this case is mainly a shift from curative treatment to palliative treatment, and that is the main, point that you have to get across to them, right? So
Okay.
mainly, if you do have, so it was mentioned that the NG tube would be removed, and so that's very important to mention everything in the task. So I think in the task it was mentioned that you're supposed to remove the NG tube, so you have to mention those things
All right.
specifically.
All
All
right.
right.
Okay.
One important thing that I'd like to tell you is whatever is mentioned in the candidate information, you have to use them. And whatever is asked you to, relay to the patient, you have to relay that way. All right. So because you're getting marked on, the task that you are asked to do. So how much of what you are asked to do are you doing? They definitely want to assess you on that fact. All right.
Mhm. All right.
So, all right. So understanding that, you know, so I did, you did mention that fact about antibiotics. Also, Dr. Umar brought up a very good point on what was his, previous conditions that he was living with, and that is something that he was used in the management itself. So when you're already saying that, let's just quickly check out this case. So when you're already saying that there were a couple of, he has had a stroke, you would want to know his past medical history to understand, what led to the stroke. So that way it will be easier for you to explain. And the follow-up questions for that is that, that this patient will if he, so this patient has hypertension and, hyperlipidemia. So would you be
Okay.
giving hypertension and hyperlipidemia medications to this patient during palliative care?
Okay.
Would you be giving? That's a question. Would you
No,
be
no,
giving?
no, no. I no, no. We won't
You won't be. Why not?
because I feel like in a palliative care we're not supposed to give yeah, we are supposed to give some painkillers medication subcut, but I don't know whether we are going to give the hypertensive or hyperlipidemia medications or not. But
So in this palliative care, this is basically end of life care. All right. That means that was done. It clearly showed that there was the extent of the stroke was pretty major, and and it is very unlikely that he will recover from it.
yes,
So what do you understand from that sentence? When I say that the recent scan that we did, we saw that the area where the blood, the deficiency of blood in the brain it was a very major, and it looks like it is, it's very unlikely that he will recover from this. So what do you understand when I tell you this? What do you understand from this?
um, but I'm not sure.
That he's dying, right? That's basically it. That
Mm-hmm.
he's unlikely to recover from this. The
Yes,
air, of his brain that has been deficient of blood is very major, and
yes,
it's unlikely that he will recover from this. So basically, he is not going to recover at all.
yes, yes.
He's been unconscious for the past 7 days, and it's going to continue to be so. So until this past 7 days, you were giving him curative treatment. You were
Okay.
giving him treatment to cure him, right?
Okay.
But after
Okay.
this case, you have found out that there was on the CT that the area of stroke or ischemia. When I'm
Okay.
explaining it to you as stroke and ischemia, make sure you use layman terms when you're explaining it to the patient. Yes, is a very major part of the brain, and hence it's very unlikely that he will recover from this. Hence, we are not treating him for cure, we are treating him for end of life.
Mm-hmm.
Do you understand that? So indirectly, if you are actually trying to say that if the patient comes out to say that, are you killing him and all that, then you can
Mm-hmm.
actually tell them that, unfortunately, there is nothing more that we can do to cure
Mm-hmm.
him, right? So we are
All
trying
right.
to that he is comfortable in his last phases of life.
Okay.
So if at any point they say that you're killing him or any indication of death, it is exactly what you have to tell them, that yes, it is imminent. This particular state is pretty imminent, and that's exactly what we are preparing for. So if it comes to giving medications, these medications for stroke, I mean, the what we say cholesterol and hypertension, these are to prevent any long-term complications which will not be needed anymore. So you will not be giving any medications for that. And antibiotics is also something that you do not give in palliative care. Palliative care is end of life care. You will
Yes,
not be.
I have idea about this thing as well, but somewhere I'm not sure where because not from my notes. I have read, that sometimes if the person condition is becoming so severe and he's having a lot of pneumonia or something like that, then the specialist can decide at that point that whether they want to give antibiotics or not.
And one thing, you are over here in the capacity of an FY2. So you will not be making decisions that a specialist would be making. All right.
Yes. Actually, my question is because I mentioned that that's going to be a specialist call. He's going to decide that whether at certain point we might give you antibiotics, but that's again going to be a specialist call. Can we say that, or we're not going to say this thing too?
No, you'll just have to relay the fact that we are treating him for palliative care, not for any cure. You
Okay,
know,
all right. Okay.
even if an infection does happen,
Mm-hmm.
you
Yeah.
are be treating for to make sure that he is comfortable. Any point
Mm-hmm.
you can't say you're curing him because you're not treating like that. Anyway,
Mm-hmm.
if you want, I'll make a short blog addressing all the segments of palliative care and what if another superadded infection does come in, how to actually deal with that, and in an FI position, how would you actually communicate that information? Yeah, how does that work? Then you can check out the blog and we can discuss different scenarios where what would be needed and to communicate this
Yeah,
information.
sure. Actually, you have an idea about this thing as well, that we have multiple notes about and multiple, teachers and everything, and everybody is saying different sort of a things, right? So sometimes even you don't know that what is the right thing to do. So according to my knowledge, yeah, I have this idea that we are not going to give anything to the patient. Yes,
Absolutely.
but then again, I have read the same
I,
question that
I just
are
want
you going to give my father's antibiotics? The answer was yes. That's going to be actually the answer was more or less like that's going to be a specialist call. But at a certain point we might have given we might give provide your father with antibiotics. So that's why I
absolutely.
yes
Dr. Bharat. What we'll do is we'll actually look into some papers because it's not something that I say or you say. We'll
yes yes
actually understand what are the guidelines say, all right? So we will look into
okay
those. We're making these blogs, all
okay.
right?
Thank you so much. Thank you so much. Okay.
Now we'll give it to the examiner who will actually go through the checklist and can tell you different ways you can improve this. Yeah.
Okay.
Hello, hi, Dr. Vardha.
Hello.
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 overall, your performance is really good. You know the process of actually how to do a breaking bad news. That is really good.
Mm-hmm.
And actually manage the emotions of the patient of the simulator really well too. And Dr. Umar, thank you so much for the performance as well. So one thing that I wanted to tell you was when you're not sure about what phrases to use, just try to be as simple as possible. Like, for example, so when you are trying to tell that, the father is not going to be, not going to make it. So
Uh-huh.
you were little struggling to say those words. I'm not sure if you realized, but you were saying something like he won't make out from it, right?
Yeah, yes, 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 yes. Yeah,
So
yes.
that's very colloquial way of saying that he won't survive, right? He won't make it means what does it mean? He won't make what? Right?
Yes,
So
yes.
never give them way. So even though most people will understand that, but that's not something that you would use in a clinical situation, right? That's a colloquial way of talking. Never try to use those terms. All right.
Okay.
How do you say that he's going to die? You'll say that he will not be. Unfortunately, he will be. It's unlikely that he will survive.
Okay.
That is as clear as you can put it, right? So do not give them ways that where they can assume things wrong. All right.
Oh,
So
okay.
always try to be as clear as possible with the phrases that you use, because that's going to hurt you, because colloquial ways of talking is very bad, in especially in a case like breaking bad news. You have to be very careful with that. Okay.
All
But
right.
after that, yeah, you did really well. We'll just go through the points one by one.
Mm-hmm.
So data gathering. So you followed the spikes protocol. That was really good. Um, but make sure you always ask, like Dr. Umar said, always also ask your the past medical history, medication, previous
Mm-hmm.
stroke, and so that is PMAFTOSA, and social history is very important in breaking bad news,
All
because
right.
is going to happen to the person that you are delivering the news to? Who does he have as support in his life? Who does she have as support in her life? Right?
All right.
Because you don't know if she has anyone else, or if she's going to be left alone after the relative dies, right? You don't know that unless you
All
ask them. And
right.
imagine the amount of financial struggle that they will be in, having to, losing a family member. Who know? How do you know whether they're financially supported or not? So all these you have to ask in your data gathering so that you can bring it back in your management.
All right.
Sometimes it becomes a little difficult to ask these questions if they're very anxious and they're pushing you for the news. Then try to ask them after the news is over. After you deliver the news, you can
All
ask
right.
these questions. But never forget to ask these questions, because your data gathering is incomplete if you don't ask all these.
All right. Okay.
Those are the main things that you missed. That's PMAFTOSA, past mental history medications, and social history, presence of caregivers, any other dependents. What if there are children, who are dependent on them? What if there are other elderly people who are dependent on them? You need to find out how to care for them as well, right?
All right.
So important. Then ideas, concerns, and expectations. I think you missed that. Never forget ICE.
Uh-huh.
ICE is very important. Even in a case like Breaking Bad News, you still
Mm-hmm.
have to ask what her main concerns are, because she might be saying something like, I'm going to have a baby and I want him to see my baby. Will he
Mm-hmm.
survive? And there are cases like that. So always ask the ICE, because that will actually tell you what their main concern is that you need to cover in your management.
All right.
All-
Okay.
Then, but otherwise, yeah, very good data gathering and management wise. Management also, you covered most of the things. One thing is, so like Dr. Ann was saying, so did the simulator ask you about the antibiotics? I'm sorry, I missed that.
Yes, yes, yes. He actually asked me, "Are you going to give my father with antibiotics?" I guess that's the question.
Okay, yeah. So if make sure that that's one thing is, unless they bring up something specific, do not try to answer them. Like just because
Okay,
they have notes, don't bring it up. All right, that's one thing. I mean, here they asked it, but otherwise, if they don't ask it, don't bring it up. That's one more thing. Especially things that you're not sure about. Um, and one more thing, and what you said is good. That putting the onus on the specialist or senior, that's a good tactic. Whenever you're not sure about something, best way
mhm,
is to say that is in the hands of the specialist. They will decide whether it's going to be done, and
okay,
stop it at that. Don't say they might give it. All
okay,
right,
all,
because
okay,
yeah,
okay,
that's not necessary. Once you already said that they will decide, that's done. Um,
all right.
Again, if you follow up that with their, sometimes they might give it. That might actually be considered as a wrong information if the examiner, finds if the examiner has something about against that, they might
Okay,
penalize you for that. So that's
okay,
one thing. Otherwise, inform about the important update, warning shot, mentioning the CD findings in simple terms, and delivering the bad news. It has to be clearly, all right? So
okay, okay,
always try to use the terms. So main thing is that you need to tell them that he will not survive, right? So
all
that
right.
he will. So use those terms. So either say that he will die, which is a little harsh, or say
Mhm,
that it's very unlikely that he will survive, right?
okay,
It's a little nicer way to put it, okay?
okay,
Or still unlikely to recover or unlikely to survive, okay?
okay,
And so the main thing is decision here is stop the ongoing treatment.
okay.
And why are we going to stop the ongoing treatment is because the current treatment that he's taking, especially for his
Mm-hmm.
the hypertension,
All right.
those medicine that he's taking, although they do have their own their benefits,
Uh-huh.
in that state, they're not going to be able, they're not going to help him in the long term, in the long run, right?
Uh-huh.
Rather, they're also difficult to be given, especially because they're oral medications, right? So
Okay.
that's the thing that you can mention because if we give him anything orally at this point, it might introduce other complications. That's one of the reasons that we do not give these medications as well. All right.
Okay.
And another thing is, then I explain what the palliative care is. Palliative care, main concept of palliative care, medications in palliative care is that they are all subcutaneous. All right.
Mm-hmm. Okay.
Subcutaneous route is the safest route. There is no, I mean, after oral, right? And subcutaneous is the safest route because IV will always have other complications. IM can cause hematomas. IV can introduce infections that can
Mm-hmm.
go to the heart. Whereas subcutaneous is relatively safe and there is good enough bioavailability compared to oral route.
Okay.
That's why subcutaneous route is preferred in most palliative care medications. So if you look at the medications that are given in palliative care, they're mostly subcutaneous. Morphine, nausea medications,
Mm-hmm.
sometimes laxatives are given, they're given per rectally most of the times. But yeah, even that is also which has good bioavailability as well, right? And for anxiety, sedatives like midazolam are given. So always all these are subcutaneous. All right. Then this part, like Dr. Ann mentioned, never forget things that are given in the candidate info. You have to definitely mention that in your management because otherwise that's the task for the station. So do not skip the task for the station. All right. So NG tube is going to be removed. then because you need to say that because the simulator has a question. So why are you reviewing the NG tube? Why would they, then how will you get the nutrition and things like that? So if you don't get that out of them, it will still be incomplete. Your concerns from the simulator will be incomplete. They won't be covered fully. All right.
Uh-huh.
So make sure you're always finishing all your tasks. So you tell them
Okay.
that the tube is going to be removed because it's a lot of discomfort to have a tube, that's going
Mm-hmm.
into the stomach. So at this point, we want to keep him as comfortable as possible. So we're not going to be giving that. We're not going
Okay.
to be keeping the tube anymore. All right.
Okay.
So the question that he asked about, won't stopping these medications, won't it kill him, right? So we can say that it's not going to hasten his death. It's not going. So stopping the medications for example, in a normal hypertensive patient, if we stop the medication, let's say for a few days, it's not going to immediately kill them, right? It's only going to lead to long-term complications. So
Yes.
it's the same in this state. So by stopping these medications, it's not going to hasten his death. That we are only it's not going to be it's not going to be helpful if we continue the medications. That's one of the main reasons that we are stopping them. And also, if we give them orally, there might be other complications. That's one of the reasons that we are stopping them, right?
Okay.
So this is one thing. And other than that, yeah, we can say that we are not, giving up on him. We are trying to keep him as comfortable as possible in his last minutes, right? Then, other than that, the ones that you missed, summarizing the main points. So this is very important. You need to understand whether the patient understands what has happened so far, what you've told her. Because most of the times in these Bani's cases, you have enough time at the end to
Uh-huh.
actually summarize. So try to summarize at the end, saying as we've discussed, that the team has decided to shift his medication treatment from curative to palliative. So instead of saying that, should say that we decided to stop the medication and start him on palliative care. And if then, so every doctor will tell three things to in every station. So in management, whether you have got the diagnosis or whether you know what the management is or not, you always have to do these three things. That is safety netting, follow up, and leaflets and pamphlets. Right? Because these
Uh-huh.
three will definitely net you at least 2 marks or 2 to 3 marks even sometimes. Because
Uh-huh.
the most important points that show that you're a safe doctor. That
So
is
how are we going to do safety netting in this case? Because, the patient is already dying.
exactly. So how would any idea how would you want to do a safety netting here?
Like, if you feel like your father is having any worsening of symptoms or something like that, just ring the button behind.
That's
Yes.
okay.
Yes.
And is there anyone else that you want a safety net for?
Um, no, I'm not sure about that.
Similar to themselves. How are they going to feel after you give them the news? What if they
Okay, okay, okay,
harm themselves in
okay,
the grief, right? So safety netting is for that also. So I can totally understand that this is a very difficult time for you, and if you need anyone to talk, if you feel like the
you
talking
need to.
to,
Mhm.
please feel free to reach out, and we have a lot of support, resources available that you can talk to anyone. All right, that's enough. That is safety netting for her. All right.
Okay.
And that is one thing. And leaflets and pamphlets also. So palliative care, you explained everything, but you don't know if they've literally given them a very shocking information. You don't know how much they have actually retained. So you have to give them reading information always. So leaflets and pamphlets have to be there in every station. All right. Do
Okay.
not that it's going to be it's going to feel like you're scripted or not. But in NHS, leaflets and pamphlets are the most important thing in management, because NHS, they don't want the patients to go and Google their things. They want them to be well informed from the right sources, right?
Okay.
You always have to say, either say reading material, or either say written or printed information, or say just leaflets and pamphlets. It's fine. All right.
Okay.
Always say these things in every single station. Okay.
Okay.
Then safety netting, and then follow up. So just follow up here is just say that I can totally understand. You might have more questions. If you can't think of them right now, please feel free to come back and talk to me again. All right.
Okay. Right.
For yeah. Other than that, your interpersonal skills are really good, and yeah, it's pretty good. I think your interpersonal skills in this station are really good. But like I mentioned, do not use phrases, colloquial phrases, right?
Okay.
And especially in sensitive stations, do not use colloquial phrases at all. Always try to be as clear as possible. Okay. So I just wanted to show you the case. Just a few questions that the simulator might ask. So what does palliative care involve? Palliative care focuses on keeping your father comfortable and pain-free. Since he is in a coma and not able to recover from this condition, our goal now is to provide care that maintains his dignity, eases any distress, and supports him and your family emotionally. This means carefully managing his symptoms like pain, breathing difficulties, or agitation, and avoiding treatments that might cause discomfort without offering meaningful benefit. Right?
Mhm.
By stopping the treatment. That's a very understandable concern. We are not stopping care, we are shifting the focus. Instead of treatments aimed at curing or prolonging life at all costs, which may no longer be effective or in line with his condition, we are now prioritizing treatments that ease discomfort and allow him a peaceful and dignified experience. Some of the medications he was taking, like those for blood pressure or cholesterol, are designed to prevent future events, but in this situation, they no longer help and may even cause harm. Alright?
Okay.
And can stopping his medications kill him? That's a difficult but important question. The truth is, your father is already very seriously ill, and unfortunately, the stroke has caused irreversible damage. Stopping medications like statins or antihypertensive at this point won't cause his death, but continuing them may not change the outcome either. What we want is to avoid unnecessary side effects, burdensome interventions, or discomfort from treatments that no longer offer real benefit. Our focus is on making sure he is peaceful and supported in every possible way. Right? So this, just try to paraphrase these things and say in a way that you are comfortable speaking. So try and whenever you're trying to say these long phrases, make sure you've rehearsed them once before.
Okay.
Or it has to come naturally from your own words. So try to learn things and try to say these things from your own words. Like try to put them in your own words instead of actually trying to say these from memory, because that will sound very rehearsed. All right. Yeah, I think that's all from my side. Do you have any questions?
No, thank you so much for explaining everything.
I'll just hand it over to Dr. Han.
Hi, Dr. Varda. Yes, and thank you, Dr. Rohit, for that great explanation. Definitely, I think I'd also want to reiterate this fact that if at any point you feel that you do not know, the answer to the question, the best way is to actually involve seniors who would be capable of making those decisions, right?
Okay.
So over explaining that fact would actually, you may actually say something that might not be, factually correct. And
Okay.
the other thing that I want to say is if you know about something, definitely mention it. But if you are confused about it, it's better not to mention it. And I did a little bit research while you guys were talking. So I have this paper. I'm just posting it on the group. You can find it on the chat on the effectiveness of antibiotic in palliative and hospice care. So you are absolutely correct. Sometimes these medications can be given, but those are for mainly directed in long-term palliative care. In this case, we are actually looking at end-of-life care, and most these are medications that are not usually offered. And also, because offering these medications, especially in these stages, does not really prolong or benefit, the patient, and may also introduce some antibiotic resistance, which needs to be controlled at all cost. So I've linked the paper. I'll be doing a little bit more research and making a blog directed at this. So this is just one paper that we have found. We will be doing more, and we'll be writing down the references so that if you want to do your own reading, definitely go ahead and do that. So what we will do right now is we will take another mock, and yep, let's see how you do there. So good luck.
Enter the room.
Hello, examiner. I'm Dr. Tariq. My GMC number is 8270516. May I proceed? Hello.
Yes, please proceed.
Okay. Hello, I'm Dr. Tariq. I'm one of the doctor in this department today. I believe I'm talking to Adam Tucker's daughter.
Yes, doctor.
Okay. Well, before proceeding further, can you quickly confirm your father's name and age for me, please?
Yeah, doctor, my father's name is Adam Tucker and he's 70 years old.
Okay, well, can you confirm your name, please?
Yeah, doctor, my name is Jolene Tucker.
Is Julia fine with you?
Sure, doctor.
All right. Well, Julia, I'm here for you. I'm here to discuss your father's condition with you. I'm here for that, and I'm also here to address all of your concerns and questions you might be having in your mind. Okay. But before proceeding further, I just want to have a quick conversation. Is that fine with you?
Sure, doctor. I'm here also as well to understand my father's
Mm-hmm.
current condition and
Mm-hmm.
what the next steps of the treatment would be.
Okay. Well, Julia, I understand, that might be a little bit difficult for you to recall everything again and again. But is it possible for you, so if you can tell me that why your father has been admitted with us 7 days back?
Yes, doctor, my father
Mm-hmm.
he collapsed at home while eating
Mm-hmm.
a breakfast almost 7 days ago. He
Mm-hmm.
was not moving and not responding, so we
Mm-hmm.
called an ambulance immediately. And upon arrival to the hospital, he was diagnosed with the medical condition called stroke.
Mm-hmm.
So till then, he has been receiving treatment, but
Mm-hmm.
there has not been any much improvement. And
Mm-hmm.
today, I was informed that
Mm-hmm.
you will give me an important update about his condition. So, doctor, what's
Mm-hmm.
my father's current condition now?
Well, Julia, I'm so sorry about that, and it must be very difficult for you, being a daughter, seeing your father going through all of these things. And yes, I am here to discuss your father's condition, but before proceeding further, do you have any idea what stroke is, or you want me to explain it for you?
No, doctor, please explain it to me. No one did it before.
Okay, and yes, stroke is just like any other organ in the body. Our brain also need a blood supply, and whenever this blood supply, got stuck towards the brain due to some reason, the person start having symptoms, or the person we term this condition as a stroke. Okay.
Doctor, will he be all right? Is it something serious?
Well, yes, it is a serious condition, and yes, we are going to discuss everything with you. But before that, I just wanted to, know that whether he's ha having any other long-term medical condition, like, diabetes, hypertension, or anything like that.
He has high blood
Mm-hmm.
pressure and high cholesterol.
Okay, and when was he diagnosed with this condition?
It has been a long time, almost
Mm-hmm.
10 years now, I guess.
All right, and was he taking any medications for it?
Yeah, he has been taking the blood pressure medications and the
Mm-hmm.
cholesterol lowering medications.
All right, okay. Any allergies?
No,
Okay, and apart from this, antihypertensive and blood pressure controlling medication, was he taking any other medications?
no, doctor.
Any family history of anything, any strokes, anything like that?
No, doctor.
Okay. So, who take cares of your father?
Doctor, he lives alone, but
Mm-hmm.
he gets frequent visits from the family members. Like I
Mm-hmm.
frequently visit him as well.
Mm-hmm. Okay. And, just you and your father or somebody else, your sister, your brother, or husband, sorry, his wife, anything like that. Any other family member?
Yeah, doctor,
Mm-hmm.
my brother,
Mm-hmm.
he also
Mm-hmm.
frequently visit him. And
Okay.
regarding, my mother, she
Mm-hmm.
passed, almost 5 years.
I'm so sorry about that. Mm-hmm. Okay. Well, okay, Julia, thank you so much for answering all of my questions. Do you have any idea do you have the lasting power of attorney and are you next of the king?
Not sure if the father has the lasting power of attorney, doctor.
All right, okay, okay. Do you have any idea, why I'm here and why I'm talking to you?
Yeah, doctor, as I told you before that I
Mm-hmm.
was informed that there will be an important update regarding my father's condition
Okay.
because last I checked there was no improvement.
Mm-hmm.
So I'm really worried and anxious. Like no one is telling me and what's really going to happen to my father.
Okay, well, and do you have any specific concern?
Yeah, doctor, he has not been responsive to me as well.
Mm.
So yeah, I'm
Okay.
really worried.
Uh-huh. All right. Okay, well, Julia, do you have any friends or family you want me to call them for you, or you are here alone?
I'm here alone.
Mm-hmm.
So I don't have any friend or family right here, right now.
Mm-hmm. Okay, so well, Julia, we are here for you. If you need any help regarding anything, we are going to help you. Okay. So, well,
Mm-hmm.
you already know that your father has been admitted with us 7 days back, and we were treating him,
2 minutes remaining.
we did a CT scan for him, and in terms of CT scan, I do not have a good news for you.
Uh, uh, what's that mean, doctor?
Actually, the CT scan shows that I'm so sorry to inform you that unfortunately he's going to recover from this condition. I'm so sorry about that.
What do you mean, doctor? Like, is he gonna die?
And I'm so sorry to mention you this thing that it is highly unlikely that he is going to recover from this condition. I'm so sorry about that.
Okay,
I'm
that's
so
a lot to take in.
Yes, I'm so sorry for being the bearer of this news. And don't be hard on yourself. And whenever you're ready, we can discuss again. Okay, if you need time, you can take your time. That's totally fine.
Okay. So,
Okay?
doctor, what are you going to do for him right now?
Yes, well, actually, the multidisciplinary team and the doctors, we have decided that we are going to, start him on, palliative care. That's actually a supportive and comparative care in which we are going to make sure that, he is not in pain. He is as comfortable as possible. And yes, one more thing that we were giving him food through the nasogastric tube, but now unfortunately because of his condition, we are going to remove that from him as well.
So, doctor, like, you are removing all of the emergency treatments and stopping the treatment. So, does it mean that stopping this medication will kill him?
Well, it's a very difficult question to answer right now, but
Move on to the next station.
All right, guys. Good job, Dr. Varda. I think,
thank you.
yeah, that was great. Just that you ran out of time towards the end and you had a
Yes.
lot. Yeah, that's totally understandable. So, yes, unfortunately, because of that, your management couldn't have, you didn't completely finish management, but
Mm-hmm.
that's completely all right. One thing that we actually advise, especially, when you know that you're short of time, because I noticed that you only started your management when only 2 minutes were remaining,
Yes.
right? We can definitely cut down on a lot of questions. You asked questions, you asked medication twice. You know, you already have
Okay. Mm-hmm.
long
Okay.
medications, does he take any medication? Apart from this, does he take any other medications?
Okay.
Anything more? And then you
Actually.
ask family history as well. I mean, it's kind of not needed because it's a known diagnosis, right? So
I'm
you're
sorry. I'm sorry. What was unmuted? Your voice was cut down. I'm sorry.
I'm sorry about that. So you asked about family history as well. So unfortunately,
Okay. Okay.
asking about family history will not help you much. So whenever you're
Okay.
asking questions, just think about it. You know, think to yourself like, how is this going to help me in management, right? How
Okay.
is it help me explain his condition a little bit better, right? So definitely think about them because you have only 8 minutes and you have to find a way to equally divide them in data gathering
Mm-hmm.
as well as management.
Okay.
And in cases, you have a lot to talk in management. So one
Okay.
that we give everybody, especially when you start realizing that you're going to run out of time, when it comes to the fact of what you're going to do for him, you can
Okay.
explain a couple of things in one breath, where you can say that,
Mm-hmm.
uh, now currently we're planning to shift the focus of treatment from curative to an entity called palliative, and explain palliative a little bit, and also add the fact that I have some leaflets so that you can refer to even after when you go home and try to understand.
Okay. Okay. Okay.
And I'd also want you to reach out to us if at all, if there are any questions or if you require any further help, right? So
Okay. Okay.
safety
And
netting, and in this case, leaflets and pamphlets as well, right? So you can say that in one breath because this is a common practice in the NHS to be offering these, things. So definitely they want to see, are you aware of the fact that this is something that we offer? This is something. So you want to show the examiner that you know the routine of giving management. What are
okay. Okay.
that you add? So once you start realizing that you're losing out on time, try to somehow fit these points in. Do you
Okay.
understand? So that way,
Okay.
keeping the examiner aware that, these are your management things that you're going to include, and then take time in explaining the specific areas because there's going to be a lot of back and forth from the patient as well, right? So when you are required to answer their questions and address their concerns. So that is
Okay.
something we're offering time for. And in between, you actually fit these important aspects of management in. So another one important thing that I noticed in both the times is when do you take a pause? You know, when you're giving
Mm-hmm.
breaking, when exactly do you take a pause?
Mm-hmm.
You know, when do you take the pause? You are taking the pause immediately after saying I don't have any good news, and then you pause. That's something that I noticed.
Yes. 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 Because I believe that, okay, I'm not supposed to take pause at that point.
No, but you are supposed to take a pause at some point. But why do you take a pause at that point? Like I don't have any good news because, see, the whole
To
point
make
of taking,
him, to make her a little bit, you know, to understand her that I'm going to tell her a
all
bad
right,
news. So that's why I am taking a pause at that point,
understand. So that's basically you're giving invitation for that. Would you like me to proceed?
Yes, yes.
We are going to discuss about your father's condition. But the whole point of pause is so that the information sinks in and you are giving them time to respond to the most terrible part of the information that you're required to give,
Mm-hmm.
right? So I mean to
Okay.
say that, in this whole case, what is the worst information that you're giving?
The CT scan reports, one, but
And
it is highly unlikely if he's going to, and palliative one as well.
palliative is the strategy. It will come into summary and strategy bit. I mean, like, what is the further treatment? But what
Mm-hmm.
is the worst news? Yeah, CT scan is right, but you
That
can't
he
give
is
it.
not going to, recover from this.
He is not going to recover.
Yes.
So if you are going to say something like that to a patient, try to put yourself in the patient's position. If you're going to, tell something like that to the patient, you
Mhm.
definitely need to give them some time to, make sure
Yes.
they relate to that information. So this is something that we actually try to tell everybody, that after you, once you give knowledge, knowledge is a very delicate, the most delicate part of breaking bad news, where
Mm-hmm.
you start with what they know, what they
Mm-hmm.
don't, and end with the worst part of the news. So in this whole scenario, you have to think, what is the worst thing I'm going to tell this patient, and leave it for the end so that you can give a pause after that. All right.
Mm-hmm.
Practices like as your father who has been suffering from hypertension and hypercholesterolemia for a very long time, suffered a stroke 7 days back. He has been admitted with us since then, and unfortunately he hasn't been recovering. So from the recent CT scan that we did, we found that a large part of his brain was severely damaged because of lack of blood. And
Mm-hmm.
unfortunately, I'd like to say that he won't be recovering from this. Pause.
Okay.
See, do you understand the whole idea of pause? So
Yes,
then
yes,
when
yes, yes, yes. Yes, I understand that, that I should take a pause after the uh,
the worst
most,
part,
yes.
so when
Okay.
you read the question itself, try to decide in breaking bad news which is the worst part of the news. So because you have to prepare to pause for that. Do you understand?
Okay. Yes.
So, yeah, after you relate that, they will have a reaction. So they may cry, they may, they may be shocked, and they may, not say anything. So your next thing is emotions, the E part of spikes, where you will be identifying the emotions that they have. Either say, I can see you're very upset. I can see this is, or whatever the emotion it is. So in angry patient, you will be saying, I can see that you are angry, or whatever it is. So understand the emotion, mention it. E, V is validated, and anybody in your position would feel this way. And then empathize. And I can totally, I can totally understand where this is coming from. So EVE. So this itself will, make them feel that you are in solidarity with them. That kind of gives them a little bit of comfort. So after you
Mm-hmm.
do that, then only discuss the strategy, like what we are going to do next.
Okay.
Right? So the basis of doing the spikes protocol. This is a globally known protocol, especially for any kind of breaking bad news. It's widely practiced. So definitely go through a couple of breaking bad news and try to understand what is the worst thing in every news, and try to
Okay.
be part of it, because that's
Okay.
very important, because that's the most delicate part in these cases. All right.
Okay.
So after the strategy, in the strategy part is when you're really having the conversation on if they have any further doubts about the medications, about what's going to happen, right? So those are you're planning a strategy with them. You're actually answering their questions, all right? And you're deciding what could be done, all right? But
Okay.
definitely this was a great performance. I will hand it
Thank you.
over. You did not, I have to say, you did not have the time to finish it, but it was going very well. You can cut down on a couple of questions here and there, because you need to understand
Okay.
how questions help in management. Think about those facts when you're asking questions, right? Because you only have so much time, that is. Right? So I'll hand it to the examiner, who will take over from me. All right.
Okay.
Hi, Doctor. It's a really good improvement from previous one. That's actually it's very comforting to see.
Thank
One
you.
is that yeah. So whenever whenever someone tells you that you need to ask a few questions, try not to ask everything of those. Like
Okay.
this example, but that's okay. We just ask the family history extra and medication. They spend a little too much time in asking about medications. But yeah, after that it's fine. Your data gathering was much better this time. I'll just share my screen.
Mm.
Yeah. So if you see the previous one, you got 222, and this is 323. So that's very good improvement compared to the previous one. And only thing that you missed here was eyes. But yeah, I mean, you did do the eyes, but make sure that you ask it directly. So the words, ideas, concerns, and expectation, these three words have to come out somehow, right?
Okay. So do you have any idea what it is?
Yeah, but here it's fine. But yeah, in general, I'm saying, so whenever you
Okay.
ask guys, make sure that you will use these three words. So here it's fine. Just concerns and expectations are fine here. But in any history station, you should use the word idea, or you need to say, do you have any thoughts about what this could be? Best is to actually say the words ideas, concerns, expectations, because that's what the examiner is specifically looking for. Right, that is one thing. Excellent improvement in data gathering and in your management. So this then removing the NG tube, that part I think you missed again. And you didn't have enough time at the end, I think, to summarize the points again. But yeah,
Yes.
all right. It's just keep that in mind. If you do have time, always summarize at the end. All right. Other than that, yeah, it's prioritize actually giving, and trying to cover all the points first. So main thing is safety netting, leaflets, and pamphlets, and follow up for management. And your interpersonal skills also improved a lot this time. But like Dr. Ann mentioned, you need to learn how to focus properly
Yes.
during spikes protocols. So the Eve protocol is something that you can follow in these by breaking bad news and angry patient. So angry patient has two types of angry patients. There are patients who are angry from the beginning. The moment you
Okay.
enter the room itself, they'll be screaming at you. Or there will be patients where you deliver news and then they get angry. All right. So
Okay.
which is similar to breaking bad news, right? Technically. So you're giving some news and then after that they'll show their emotions. So it's the
Okay.
same. You can use the spikes protocol even in that case as well. And even in the angry after disclosing, after you disclose, it's usually the medical error cases. So
Mm-hmm.
and also the E part has E protocol. All right. Identify the emotion. So identify the emotion is also something that you can, that helps a lot in other things. So it's not just the emotion that you need to identify. You need to identify any non-verbal cues that the patient is giving out.
Mm-hmm.
Right?
Okay.
Patient
Okay.
is looking down, not making eye contact, or if the patient is yawning and seem very tired. It's all these things you always have to notice, and don't just leave it at that. You say it out loud. Say that I can see that you seem uncomfortable. So if they're not looking at you, or no, I can see that you seem very tired, or I can see that you are upset. I can see that you are angry. So if by doing that, you're showing the examiner that you've identified an emotion that the simulator is showing, right? That's very important here. So that's the first step of Eve protocol, which is identifying the emotion, right? So identifying means you have to say it out to the simulator, which in turn you're also telling to the examiner, also saying, yes, I noticed that. All right.
Okay.
That, and V is validation. So validation is very important. In a way that you're saying, whatever you're feeling is right. It's not wrong. Anyone in this situation would feel the same way. All right. That is one thing. And
Mm-hmm.
empathize. So empathy, your empathy is good. You're doing that really well.
Okay.
But yeah, I think overall excellent improvement. Do you have any further questions for me?
No, thank you so much.
Fine. Does anyone else have any questions? All right. I'm just gonna drop our WhatsApp group link for anyone who's not already on the group. So we'll be conducting these regular practice sessions from next Monday onwards. We'll keep posting. So we're getting a lot of overwhelming responses to be able to be the candidate. So we're going to drop a form where you can fill to be able to become a candidate. Everybody else can join and observe, but if you want to participate from now onwards, you would have to fill the form. So we'll do that. And other than that, for the doctors that have that are missed, um, before we have the new practice partners app, I'm just posting that link also in the group, in the chat. Please do check it out. Sign up there. Maybe in another week or so, there's going to be enough doctors there that you will be able to find your ideal practice partner. Right? And I'll just hand it over to Dr. Anne.
Absolutely. Thank you everybody for joining in for today's session. And like Dr. Rohit mentioned, we will be continuing with our normal regular discussions from next week onwards. We won't be having it as frequent as a daily thing, but we will definitely try to do at least 3 days in a week. And yes, if you have, today's discussion was pretty interesting, and we actually managed to learn a lot about palliative care and the use of antibiotics. If you guys have any doubts, any questions, please drop it in the group, because as a part of practicing, you should also be open to understanding the content. And if there are any doubts or questions, please do let us know so that we can also find out the answers. We may also have the same questions and doubts. And this is something that we want to do and mutually learn and grow together. So definitely do join our WhatsApp group if you're not already a part of it. The link is there in the chat. And yes, Dr. Trust, I believe you wanted to see how the app works. So if you could stay back after the call, we can take you through the app together. Apart from that, for everybody else who wants to purchase our platform, we are running a 40% off for all the cases. We have around 532 cases that you can avail, and you can use the AI simulator to practice if you do not already have a practice partner. So I'll take you through exactly how the AI simulator works. So this, as you know, is our dashboard. Our case overview for the practice mode. For the review mode. And if you shift to practice mode, you can either practice with a partner, where you will be able to send the link to your practice partner, or you can start a video call with them. Or else, you can even practice with the AI, which I'll quickly take you guys through. So as a part of practicing with the AI, we try to simulate it as close to the exam, as there is. So you will start with a reading time, right? And I'm so sorry, I'll just share my screen again. Yes, you will start with a reading time, which is for 1.5 minutes, after which, you will be entering the room. Otherwise, you can directly enter the room.
Enter the room.
Once inside the room, you will be, you'll come face to face with the simulator, for which you have to press the microphone button to talk. Hi, my name is Dr. Anne. I'm one of the doctors from the palliative team today. May I confirm that you are related to Adam Tucker?
Yes, I'm his daughter, Jolene Tucker. I'm here to understand my father's current condition and what the next steps are.
Absolutely, I'm here to help you through that. But before we proceed, may I please confirm your father's age, if that's all right? So every time the simulator
Sure, my father, Adam Tucker, is 70 years old.
is processing the answer, make sure to pause the timer so that it doesn't cut into your, your consultation time. Thank you for that. So Jolene, before we proceed, could you please tell me what you know about your father's condition so far?
A week ago, my father collapsed at home while eating breakfast. He wasn't moving or responding. so we called an ambulance. He was diagnosed with a stroke upon admission and has been receiving treatment since then, but there hasn't been much improvement.
Yes, guys, so that's our patient simulator. So once either finish the simulation for 8 minutes, or else you can just end the session. After you end the session, you can, get the evaluation from the AI. So the AI evaluates according to the conversation that you have had, and it gives you the marks according to the checklist that you had seen earlier. So all the things that you touched upon during the time of your consultation will be processed by the AI, and accordingly you'll be getting your marks for it. So as you can see, it gets stored by date and by time by the entity that you practice with. Either it could be a human or it could be the AI that you practice with. So for today's AI practice, you can see data gathering, management, and interpersonal skills depending upon the conversation that you had. So that is a patient GPT, guys, and you can either practice with your friends or you can practice with the AI. And we are running a special 40% off for all products in the OSCE workbench. So thank you everybody for joining, and yes, next week we will see you at this time. So good luck with your preparation, and good job, Dr. Varda. And
Thank you so much. Thank you so much for everything. Thank you, and thank you, Dr. Rohit and Dr. Umar as well. Thank you so much.
thank you so much. Yes. Dr. Trust, if you can stay back after the call.
Okay, yes, thank you.
Absolutely. All right, so let's get started. So Doctor, initially you can go to the dashboard. So dashboard is the page that you will be at.
Okay.
Log in, this is the page that you get, right? So this is the page where you can actually see your overall progress in your performance. Over time, how many other cases that you have done, and overall, all the cases that you have done, what has been your performance, right? So
Yes.
all cases are in just a minute. So all the cases are actually divided into topics, meaning all the different consultation styles. So we've put it into topics. So there are a total of 11 topics, and within each topic we have mentioned categories where, say, there are different kinds of categories. It could be a rash, benign mass, miscellaneous, and some malignant mass. So within these categories, there might be cases, or in some cases, within a category, there might be some subcategories, say counseling, OBGYN, it could be contraception counseling or pre-conception counseling. And then within that, there might be cases, right? So the last section, that is the subcategory, is around 102, and we recommend that you try at least every subcategory, meaning that you will be able to understand all the different types of consultations that come. So there are a total of 102 that
Okay.
and you can see over time how you have been doing in each and every one. So you can actually see it in the brain bank as well. So if you see at this contraception level, at the subcategory level, that means you haven't practiced any case. At the counseling level, all the cases in counseling, this is the average score. And if you have practiced lifestyle counseling, this is the average score in lifestyle counseling, right? So if you want to see your practice in a particular case, then you can actually go to the case. So this is how you go to the case. So in the brain bank, if you want to search for a case, you can even type in that name, so if you want to see COPD. So you can see there are different types of COPD. Sorry, I'll just try D as well, right? So you can actually see what are the cases there, and according to which case you want to go, you will be able to click upon that, right? And then if you want to see your performance over time, you can just see for an individual case level how many times you have performed. So this case was discussed once in our discussions. So you can see that that was the one time we performed it, and you can see the marks, that you had got for that performance. This way you will be able to evaluate, how you have done over time. So that is exactly what we're trying to offer here, you know, an objective way to evaluate yourself over time, right? So that you can improve and understand what else to incorporate. So, so as you can see, this if you go inside a case, you either have the practice mode or the review mode. So this is the review mode, and if you want to shift to the practice mode, you need to click on this button. If you want to go back to the review mode, you can click on this button where you have a case overview, where it explains you what exactly the case is, what are the different aspects to cover in interpersonal skills, data gathering, and management, and what is the ultimate approach. I mean, approach from the candidate information. So this is the candidate information, and also you give the findings if there are to be any findings there. And this is the simulated information where, you know, the patient information would be given along with the checklist, what are the important aspects in the checklist. So, and a consultation guide. So a consultation guide takes you through, you know, the consultation, and at every 30 seconds, it tries to tell you what to be, at what, you know, section to be, so that, you know, you manage to incorporate or you manage to cover the entire station in 8 minutes. So this is a way that we have incorporated to make sure that everybody managed to cover the station in 8 minutes, and we put some good phrases that you can use as you're doing the consultation. So whenever you're doing the consultation, if you have this guide in front of you, that would be very helpful.
Begin. Into the room.
That moves with the timer. So we have linked it to the timer that with every 30 seconds, you can actually understand at which section you need to be, and certain phrases that you can use in order to you know, fulfill that particular requirement of that section. All right, so we'll just wait for 10 more seconds and see how this moves. So that is a consultation guide. It also gives you a lot of good phrases that you can use, because sometimes you find it difficult to incorporate, you know, good phrases, especially in explaining certain conditions that you might know more, you know, technically, right? So that's, it just moved after the 30 seconds there. So after this, if you want to practice with your partner, you switch to practice mode. In the practice mode, you can either, you know, practice with the partner, or you can practice with AI. If you're practicing with the partner, you will be able to open, you know, a link. So if you click on this link, you can share it with your practice partner, either by any source. You can, I usually post it on the chat itself. So in the chat, you can use it, or else you can even send it through WhatsApp or any other, you know, way that you can. So you just have to copy the link. You just, if you click on this, the link gets copied to Flipboard, and you'll be able to send it. So we also have a feature where we have a video call. So you can actually start a video call, and you can send the same link. So you'll be able to start the video call by the link that I have sent. We also have a lot of other interesting things that you can try, especially like a game that can get you in, you know, the routine of the exam, where you can actually, you know, the rapid DDX, where as soon as you see a symptom, you can think of all the associated conditions related to it. So if you just randomly go around clicking a couple of them and you press submit, you can see all the ones you got right, and all the ones you missed in yellow, and all the ones that you got wrong in red. So that is rapid DDX. Apart from that, we also have some, you know, blogs that we write for, especially for any doubts or any questions that come up, because we understand that most of the topics, you know, they need a certain amount of knowledge in order to do the consultation. So whenever we feel that certain areas are ambiguous, we try to make a blog post for it, especially to address those points. So we do some deep dive, we do some research to understand how it is done in the NHS. So even if you have any questions, you know, or any doubts, please don't hesitate to, you know, post it on the group, and then we can do some research and accordingly, you know, mention them. So these are a couple of blogs that we have written on certain topics. We will be linking the blogs to the OSCE workbench, so that, you know, from there itself we can directly come to the related blogs. Apart from the blog, we also have some video lectures that you can try. So if you go to master course, we have made some lectures, a certain couple of topics that you can try opening, and you can actually go through all the cases. So definitely do try them out. And we also have a prescription workbench where we managed to make one page. This is still a work in progress, but if you still want to try out the prescription workbench, we're trying to make it paperless as much as possible. So, suppose if you do, this will be your information, and according to the information, if you can fill in, say, yeah, and if you happen to fill a couple of other information, oh, this is the word. So the name is the hospital name would be over here. So the ward would be, if you see, the ward is accident and emergency. And you do fill in other information and then you press submit, you will be able to see which ones you got correct, which ones were to be written, how they were to be written.
Please like and subscribe to Turing Med School. Good luck with your preparation.